Development Institute, KIDI, welcome all of you to London Health Forum 2013. My name is Soyoung Park from KIDI UK. On behalf of KIDI, I'd like to express my great appreciation to all of you for taking time to join us this morning. Today we are gathering here to share valuable information about research-driven hospitals and academic health science centers and networks. I hope this forum will help to create links that consolidate and enrich the connections between the UK and Korea. Now let me introduce our first speaker, Professor Paul Matthew from Imperial College London. He is head of Division of Brain Science in Imperial College London and Vice President of Integrative Medicine Development of Neuroscience at GlaxoSmithKline. He is currently one of the Vice Presidents of the London Health Forum. He will make an opening remark. Please give a warm welcome to Professor Matthews.
Well, thank you. It's a great pleasure to be here. It's a great pleasure to be part of the London Health Forum. Let me also say it's a special pleasure to see my new Korean acquaintances today. I hope yesterday went well and that today will be exciting and you'll have a further very positive experience of UK biomedical science as you go about the visits tomorrow. The objectives of the London Health Forum are important ones for both of our countries. We face major healthcare challenges. We face major economic challenges in a rapidly changing world. These are challenges that we share, and the opportunity for our two countries to work together is one that all of us, I know, welcome. The objectives today are important as the first of the London Health Forum's major initiatives. And these are to try to identify opportunities as we get to know each other. Opportunities for synergies in research, opportunities for development of economic benefits and improvements in our healthcare systems. We can take these opportunities and begin to translate them into mechanisms very, very rapidly. I know that the KD is strongly behind this initiative, and so are the UK academic institutions that you're meeting today and tomorrow. Our two countries share a very long history and a history of friendship. The United Kingdom has been particularly strong over the last 100 years in the development of biomedical science and in innovation in new concepts in medicine. A string of Nobel Prizes and benefits to both industry and academia have flowed out of this. It's fitting that 2013 is the 100th anniversary of our Medical Research Council. At the same time, Korea has been one of the miracles of economic growth over the last 50 years. And more recently, I think you have shown how you can turn a strong healthcare environment into a global engine for clinical trials and translational medicine. We have much to learn from each other, and we have many areas in which we can grow together. It's my belief that what we're catalyzing here today will be very big indeed. There really is a hunger on the side of many of the UK universities to reach globally and to embrace the common global challenges that both of our nations face. So I hope you'll take this day with the same enthusiasm that I do. I hope you'll keep in close touch as you walk away please send specific ideas forward to me, to Professor Cho, or Mr. Kim. We really want to make this a success and do so very rapidly. Enjoy the time here, enjoy your tour tomorrow, and let's make something move. Thank you.
Thank you, Professor Matthew. Next, it is a great pleasure for me to introduce Ambassador Sang-Nam Lim from the Embassy of the Republic of Korea. He will make a congratulatory address. Please join me in welcome Ambassador Lim.
Professor Paul Matthews, Lord Darcy, distinguished guests, and ladies and gentlemen. I have arrived in London just about 2.5 months ago as new Korean ambassador to the United Kingdom. And during the past 2.5 months, I had many opportunities to address this kind of forum and this kind of meeting. But I should confess, this morning's forum perhaps is one of the most meaningful venues to discuss how to further the cooperation between our two countries in the years to come, because not just because we are talking about the new area of possible cooperation in healthcare, but also because we will have the state visit by President Park Geun-hye in less than 2 months from now, which will take place in the early part of November. I'm very delighted to be here today to address the opening of the London Health Forum. At the outset, I'd like to thank the organizers for making today's event possible. In particular, the efforts of the London Health Forum Committee under its President Professor John Wood and for Vice Presidents, and the Korea Health Industry Development Institute have been invaluable. I'm also delighted that senior officials from Korean research-driven hospitals are at today's forum, alongside partners from academic health science center and networks in England. As Korea's ambassador to the United Kingdom, I'm pleased to note that relations between the UK and Korea have continued to strengthen. Our two countries are key trade and investment partners, and levels of collaboration are growing in many areas, including science, education, culture, and of course, healthcare. In 2012, the value of UK exports to Korea grew to £5 billion, and pharmaceutical products were the second largest UK export item to Korea. In this context, as I emphasized at the outset, the state visit to the United Kingdom by President Park Geun-hye this November is an ideal way to consolidate and enhance our bilateral relationship. Although our two countries have their own particular characteristics, we also face some common challenges, including how best to fund and deliver health and social care in aging societies. One way to respond to these challenges is to promote innovation, collaboration, and excellence in healthcare systems. In March this year, Korea's Minister of Health and Welfare designated 10 research-driven hospitals. They may have been intensively invested with an earmarked R&D fund from as early as next year. These research-driven hospitals have yet to learn a lot from the AHSCs of the United Kingdom, a worldwide leader in fundamental research and clinical research, treatment, and medical education, and thus expand their clinic-oriented basic research, translational research, and practical use research. I expect cooperation between the United Kingdom and Korea will assist those research-driven hospitals to become a dynamic force for new growth by promoting employment creation and higher value-added business. In England, academic health science centers and networks, which bring together healthcare providers and university partners with excellence in research, health education, and patient care, provide an outstanding model for other countries. I'm confident the coming years will be marked by growing comprehensive cooperation between the United Kingdom and Korea on future health. And one key aspect of this will be sharing information and expertise among research-driven hospitals in Korea and AHSCs in England. In closing, I wish every success to participants for today's presentations and networking opportunities. I'm confident that today's event will prove to be a crucial step for future collaboration between British and Korean healthcare organizations and between our two countries as a whole. Thank you so much.
Thank you, Ambassador Lim. And it is a great honor for me to introduce Professor Lord Aradazi for a keynote speech. Lord Daji holds the Paul Hamlin Chair of Surgery at Imperial College and is an honorary consultant surgeon at the Imperial College Healthcare and the Royal Mason Hospitals. He was also elected as an honorary fellow of the Royal Academy of Engineering and a fellow of the Academy of Medical Sciences. Recently, Lord Daji was elected as fellow of the Royal Society. He was knighted for his services in medicine and surgery in 2002 and was appointed Parliamentary Under-Secretary of State at the Department of Health. He finished this role in 2009. After that, he was appointed as the United Kingdom's Global Ambassador for Health and Life Sciences until March 2013. In June 2009, Lord Daji was appointed as a member of Her Majesty's Most Honourable Privy Council. Please welcome him with a big applause.
Your Excellency, ladies and gentlemen, it's a great privilege to be standing in front of you, and thank you for asking me to contribute to this very exciting day and also this very exciting partnership between Korea and the UK. Some of the words which were articulated by His Excellency, the relationships between the two countries. And I think it's fantastic to have an ambassador who just started in the first 3 months, because this will be in his radar screen. So having your leadership and your support, I have no doubt this meeting will thrive and produce the fruits to, in many ways, stimulate academics and translators in both countries to the better of health and healthcare. I'm going to give you some of my own thoughts and experiences over the years, wearing different hats in life, but ultimately, most of you, despite that wonderful introduction, I'm an academic. I work just across the way at Imperial College. I've had exposure in policy, and I'm going to share with you some of our thoughts and thinking in the UK in relation to innovation in healthcare, and why we are pursuing this so vigorously in the last few years, but certainly over the last decade, and some of the changes we've seen. I think most of those sitting in this room, academics who've been involved in healthcare, could only look at the last century with a huge amount of celebration. Healthcare is the one sector that has doubled the life expectancy of mankind, doubled in 100 years. You tell me one other sector, including the diplomatic sector, that has such an impact on mankind. That's a tremendous achievement. Okay, most of it was in public health, most of it was to deal with the burden of infectious disease, but that's a tremendous achievement. What's also unique about that slide is at the beginning of that century, every family was spending twice the amount of money on funerals than they were on healthcare. At the end of that century, we're spending in this country about 8.3% of our GDP on healthcare. You're spending slightly higher than us, but that is a huge expenditure, which is a very honourable thing to do in investing in the health of your nation. However, as Paul said earlier, the demands on healthcare are changing drastically. Who would have predicted the changing of the demand, the nature of the demand, about 20 years ago? Take obesity as being one example, certainly in the Western world. A major, major challenge. So the growing burden of disease, but also change of the nature of disease. The changes in patient expectations, whether you happen to be in the UK, whether you happen to be in Korea. That's a good thing. People blame politicians for it and say you are actually telling the nation certain things you're going to provide which we cannot afford. But the expectations of patients have a very strong correlation with patient empowerment, and that is extremely important. The rising unit cost of care, and this is something that happens in the corridors of ministries. The concern about a new technology coming in. And there is that perception, and I fought that extremely hard for years I was there, because the word innovation meant different things to different people. In many ways, innovation in other sectors means you improve quality, you improve access, and you reduce cost. For some reason, and this is our own responsibility, we need to prove to the Exchequer that innovation in healthcare does actually improve quality and can possibly reduce cost. We need to learn the art of decommissioning. We're fantastic in healthcare in commissioning new drugs, new treatments, new services, new delivery. But we're not very good in decommissioning of services and technologies. And I'm sure that's going to be part of your discussion today. What's interesting, and this is a slide from the Commonwealth Fund, looking at the correlation of expenditure per country, listed on the top, and the attributes of quality on the left-hand side. Quality of care, effectiveness, safety of care, access, patient-centered care. And this is looking at different countries, and also looks at the expenditure per capita at the bottom here. I'm always very nervous presenting the slide in the US, just in case they don't give me a visa the next time I'm there. Because as you can see, they have the highest expenditure per capita, and probably the worst outcomes of any healthcare system. So in many ways, I think this is probably more of a message of to the emerging economies. You know, there is no correlation between the amount of money you spend and what you get in return for every dollar you spend in healthcare. And no one has the magic formula yet, but in the UK, we do reasonably well. Whatever you hear in the newspapers, as I say, to our own, in our own country, we actually do reasonably well. We don't do very well in patient-centered care for all sorts of misaligned incentives. But overall, as a system, it delivers what we are investing in it. The only way UK or Korea is going to address some of these major challenges facing us is through innovation. And I think if you've come across this book by Judy Ernstein, which is an amazing book to read, because in many ways she very eloquently articulates that these challenges are not unique to health. Energy, climate change, we're all looking for innovative solutions to some of these major challenges. And in many ways, in the society we live in, if you've got the last century and the beginning of this century, we do have significant challenges. We've become more short-sighted when it comes to innovation. The rate in which destructive innovation is coming into the healthcare sector is getting less and less. It's mostly incremental innovation. So I think what this meeting is due is how do you get the best brains from Korea and the UK to work together in really driving this change. Which brings me back to the heart of what we're here for. Innovation is a fairly long pathway. I work in a university in which, you know, major discoveries have happened. And I think some of you have already made a visit yesterday to Imperial, and you're going to visit many other universities in the UK, and some of the major engines of new scientific discovery. And we're very proud of that in this country. We had a challenge about a decade ago in translating that discovery into evidence. The translational research side, which is the, if you like, the T2 translation. And I'm going to say something about that, and I know Jonathan Weber is here, who's led a significant amount of that work within Imperial College and Imperial College Health Partners. In the last 5 years, we started to focus our attention on not just the creation of the evidence, but how do you translate that evidence into clinical practice. That has become a science in itself. You can produce the evidence, but sadly, and this is a global phenomenon, the gap between what we know that works and what we do is getting bigger and bigger and bigger. And that is the T3 and the T4 translation, which is more population type of translation. And that is in many ways the driver for the creation of the academic health sciences centers, and more recently the academic health sciences network, which are very much a population base. So we try to address the whole pathway per se when it comes to innovation. Let me start firstly with the translation research and the creation of the NIHR, National Institute of Health Research, which was transformational when it came to translation research. And that was led by Dame Sally Davis. I hope you're going to get an opportunity to see her. I know she's made a number of visits to Korea in recent past. And single-handedly, and that was quite a challenging change to make, in which historical funding to hospitals to support research was taken away and brought back into a proper national framework that addressed a number of issues. Firstly, investing in faculty, ranging from new capacity, building lectureships, clinical academics, building research projects and programs, in many ways reforming the system, a research governance system, an information system that is interlinked. You have to remember the NHS is very unique. It's a system, and rather than a disparate and a fragmented set of providers. So aligning that system as an NHS with what you're trying to deliver from a research perspective was extremely important. And finally, infrastructure, which is the clinical research networks and a number of centres which were so-called the biomedical research centres, which recently each of these organisations had to compete for and win it back. And that was led by Jonathan Weber at Imperial College, and that's worth near enough £100 million of attributed to research expenditure in our major provider, that is part of Imperial College, or partners with Imperial College, or certainly the main partner Imperial College Academic Health Sciences Centre, in really driving that research over a period of 5 years. That is a significant amount of funding that comes from the Ministry of Health, not Science, Ministry of Health, to support the translational research in hospitals, and incurs the significant amount of cost that major teaching hospitals incur doing scientific research. A large number of networks, and mostly in areas of the biggest burden of disease. Stroke network, diabetes network, and these mental health research network. These are all research networks in which, if you're running a major clinical trial in diabetes, you know there was one network that could treat and translate and run effectively a trial across the country. You don't have to go to Cambridge, UCL, Oxford separately. There is one research network which has the infrastructure to support it. And that has been, in many ways, transformational, and this is the evidence to prove that. If you look at the number of patients recruited to clinical trial, whether they are randomized or non-randomized, then you can see, since the creation of the NIHR, the biomedical research centres, the specialists and the generalists have led to a significant increase in our recruitment rate. And that is something that we are very proud of. We still believe there is a huge scope to improve, and there are a number of other incentives that needs to be aligned to really increase that rate even further. If you look at other sources of funding, beside the NIHR in this country, we have the Medical Research Council, which invests significantly in a number of different universities. As you're going to be talking to most of the London universities here, it might be worthwhile to look at the number of MRC centres, and you can see that nearly more than a third of these MRC centres are in London. That is, we're not just the hub of finance, we just not have a pretty mayor called Boris Johnson, we also are the hub of science and translational science. And I know you're going to be meeting our colleagues from ECL and King's, and obviously it's the trio in London that drives all these third of the MRC centres separately, essentially between Imperial, UCL and King's College. Just finishing off what I said earlier, we've got that, the left bit of that graph, more or less sorted out, but I'm sure with a scope of improvement. Our recent endeavour has been the right side. How do we translate that evidence? That knowledge base that is a significant cost to the Exchequer, and the painful element, intermittently, in which an evidence could be translated in a different country before it's translated in UK's healthcare system, is how do you really drive that uptake within the UK? And we've been very frank and very open about this, that we need to improve on that. And that's really what has driven the T3, T4 translation at a population level, and the creation of so-called academic health sciences centres. That was in 2008. I remember at the time I was in the dungeon in the health ministry when the first 5 were announced. And that was quite a challenge, because we were in many ways saying these are the 5 elitist universities and providers coming together. And since then we've created a number of academic health sciences networks. And Imperial will have 2. We have 2 separate ones, an academic health sciences centre and an academic health sciences network. The network brings all the providers, including the primary care providers, together into a partnership and really driving that acceleration of uptake of innovation. And we see those as the hub. And this is no longer the tripartite mission of NIHR. It's no longer about research, education, and clinical practice. It's about the whole impact of an academic health sciences centre in relation to culture, in relation to really driving the whole educational pathway. It's not just post-graduating. Are we graduating the right doctors for the needs of London would be a good question to ask. The leadership that requires at that level. And what we're trying to do through these, in many ways these integrated models, is to drive the growth in human capital, new knowledge, new skill, by bringing these different organizations together, rather than historically the isolation of the university from the healthcare providers. Social capital, and you won't believe this, but I'm not sure about Korea, but